What do you think about the benefits and challenges of treating complex aorto-abdominal aneurysm with Aorfix?
Well, I think Aorfix offers a lot of benefits compared to other devices. The daily challenge we have is, can we treat a complex aneurysm? Can we, as the operator, treat a complex aneurysm? So we have the challenge of planning, we have the challenge of advancing the device into the appropriate position. And unfortunately, there is no device that facilitates treatment of complex aneurysm for the operator. But decision-making has become quite more easy since we have CE approved and FDA approved devices for 60 to 90 degrees treatment. But still, there remains a challenge. We need a device that accommodates to the given anatomy, and from the Pythagoras trial, we know that the anatomy and the morbidity of the patients with elongated, with severely tortuous necks or iliacs has to be seen much higher than the straightforward cases. Now, Aorfix gives us certain options. They have a hydrophilic coating, which facilitates advancement of the sheath of the device. And this device behaves completely different from others because it accommodates to the given anatomy during the deployment process, which means we have this, let's say we have a stiff deployment device like in any other device, but while deploying it, the graft slowly accommodates to the tortuosity because it's fixed by two push rods, and these two push rods are quite flexible, moving and accommodating to the given anatomy. And what you can see here on the slide, you see how it deploys, and you see how these push rods anchored distally to the tip can move to the right, to the left, and the device itself can accommodate to the anatomy. Like in this picture, you see the center cannula has a different direction than the device itself, and this makes it much more easier, much more accurate, and you don't lose sealing lengths when you deploy a device like this. It's different in other devices. They are fixed to the center cannula, and that's why they do follow the center cannula and not the anatomy. And that is probably one of the big advantages, or the big very advantage that we have with the Aorfix. And if we treat aneurysms, it's completely different from peripheral interventions. We want to have a durable solution over the years. And this is what we can see. If you lose sealing length, like in this case, where you have, let's say, 45-degree angulation, you also have suprarenal fixation. And suprarenal fixation in tortuous anatomies is not a benefit. Why? Because you have bear stents, and the device relies on bear stent fixation. If the bear stents don't have contact to the wall, you lose fixation. And these devices in this situation are prone to migration. And this is also completely different to the Aorfix, which has partially supra, partially infrarenal fixation, but due to accommodation and due to the segmental design of the graft, it slowly decreases migration forces, and it doesn't rely on simple fixation by bear stent or by bear stent fixation. What we also have, what we also have seen in a long-term follow-up, the device, once placed, does accommodate to the reconstruction of the aorta in a three-dimensional way. It accommodates to the length, and this flexible response, what I like to call it, is also one issue to respond against migration, against sideways displacement. And imagine in an anatomy like this, you would add suprarenal fixation. They have no contact, and if you have progress of the disease, add suprarenal fixation, how to advance a thoracic graft in a situation like this.
And which are the main limitations of this special type of prosthesis?
Well, the limitation is the anatomy of the renal arteries and the SMA. We need at least a distance of 15 millimeters between the lower renal artery and the SMA edge. and diameters. We have only 31 millimeter devices, top end diameter, and 20 millimeter distal end diameter. So for the bulky necks, we don't have a solution up to now.
Up to now.
Up to now.
The future?
Well, the future is in the second half of the year, we will have 34 millimeter and 38 millimeter devices, which means we can very reliably treat complex anatomies that are not invitable for fenestrated or for stiff grafts with a flexible graft, and we can use all the advantages of the graft we have already seen, and that's why it has achieved FDA approval. We can use all these benefits, the beneficial effects, for bigger diameters and probably even for more healthy people where we don't want to go for fenestrated or where we cannot go for fenestrated devices.